This week, we told you about a big partnership between St. Elizabeth and the Mayo Clinic, and this morning we're on your side to take a deeper look at really what that means for you. John Dubas is the CEO of St. Elizabeth. He's gracious enough to get up with us this morning. Good to see you. Thank you.
Good morning, Brian. Thank you.
This is significant. Obviously, we know your name very well. Mayo Clinic, nationally known. What brings about a partnership like this? How do you land this deal?
Well, you know, this was really our attempt to try to continually improve healthcare in Greater Cincinnati. St. Elizabeth Healthcare, for example, was the first hospital in Greater Cincinnati to be named a magnet hospital by the American Nurses Association, which is the gold standard for nursing care. We've also been named a top 50 hospital by Healthgrades, a national consulting firm, for 6 consecutive years, and also by Thomson Reuters, another national health consulting firm, to be a top 100 hospital in the country for the last 7 years. So we're very focused on quality, and as we look to the future, improving healthcare with the changes that are going on in healthcare reform, we wanted to find a partner that would help us do that, not just for our organization, but for the whole region. So that's how the conversation went with the Mayo Clinic.
What does this partnership essentially mean for people who use your services and come to you as a patient?
Well, this will bring, frankly, world-class care here to Greater Cincinnati now. The physicians at St. Elizabeth Healthcare will have direct access to the experts at Mayo Clinic to discuss the real difficult cases that would probably send patients to Rochester, Minnesota, or other places around the country, who can now receive that care here. So that avoids a lot of travel, expense, time, and effort, and get the really expert care of the Mayo Clinic and St. Elizabeth physicians doing their thing in the best way possible.
And certainly, it seems anytime, especially right now in the economic climate, we hear of a partnership, we're not losing St. Elizabeth. We're not losing the familiar faces and the care that we know.
No, this is an affiliation. We are still an independent, community-owned and operated hospital, but this is a network in which we will share best practices of healthcare. And the good news to our patients is that this is no cost to them. And when our physicians have consults with the Mayo Clinic, this is a free service. It's another second opinion that the patient doesn't have to pay for, and gets that, again, that world-class expert care from the Mayo physicians.
See, good work does get recognized and pays off. Congratulations.
Thanks.
Great partnership.
Thank you very, very much.
Good news there. Thanks for coming in this morning. We appreciate it.
it.